Euthanasia is a very controversial topic among many. While it is common for people to see the practice as taboo, there are just as many people that see it as a blessing in disguise. Is the practice truly moral, however? And if so, why aren't more countries embracing legislature to legalize the practice? Some European nations, such as Belgium and the Netherlands, are paving the way for the legalization of euthanasia, while other countries such as the United States, Britain, and New Zealand are combating what they claim is murder of a patient. However, there are still some areas in the United States that legalize physician-assisted suicide. These include California, Colorado, Washington, Vermont, Washington, D.C., and Oregon. The status of its legality is still being debated in Montana, however. The rest of the country still treats patients through a practice known as palliative care, which is the extended treatment of a patient with severe, albeit non-fatal illness. If the suffering is deemed terminal, the patient may receive a treatment known as hospice. Hospitals provide the service of the patient is in the final stage of his or her illnesses, such as cancer, Ebola, and HIV/AIDS.
No. Do you think a person has the right to end their life if their suffering has gotten a bit too much to handle?
And so I have gotten requests before from some of my patients who have terminal diseases like metastatic cancer, who say that they're really worried about suffering and that they want to end their life. Right? And my standard answer is it's not legal anywhere that I've practiced. I don't necessarily ethically agree with it, and I would have a little bit of a moral and religious problem with it. And so my standard answer is that I can help you so that you don't feel like you're suffering. You're going to be on your timetable and you're going to be here for however long you're meant to be here on this earth, but I can make it so that you're not feeling the pain, that you're not feeling a short of breath, and that you have as many good days as possible. And that's kind of how I answer when people ask me for hastened death or make requests like that. And I've seen people suffer with those illnesses, particularly cancer that's metastatic and it's gone to the bone. And yes, I see that they're suffering. But
I used to.
I don't ever give people medicines with the intention of slowing their respirations to the point that their life is shorter. I will give them what they need to be comfortable, and as long as your intention is that you're treating symptoms, not trying to shorten someone's life, in general, if you're doing good prescribing practices, you're okay.
I know Dr. Howard, who's an internist in town, I don't know if you know him, but I used to work with him in internal medicine before I did the cardiology. And he was actually taught before the ethics board one time because he had a lady in that situation dying of cancer, and like I say, he had her on a continuous morphine drip and kept titrating upward, and the nurses called and said, I don't agree with this. And that, but again, he wasn't trying to accelerate her demise, but trying to keep her comfortable.
And I'm glad you bring that up because that's a really important point. So I don't work in a silo. I work with an entire interdisciplinary team that involves a chaplain, it involves a social worker. We've got nurses involved. There's physical therapists, nutritionists, the dietitian, speech therapy. Everybody comes together and we talk about these cases, and we closely involve the bedside nurse who's taking care of the patient. And so everybody understands what the purpose of the medication is, and everybody's kind of on board with the plan. And I go out of my way to make sure that the patient understands what we're doing, the family understands, the nurse, everybody on the interdisciplinary team. And that provides an inherent set of checks and balances so that if everybody is in agreement about, yes, that this makes sense for us to increase the continuous morphine that they're on. Patient determines their quality of life. And so I can't go in and say, I don't think you have a very good quality of life. The way I do, I go in and ask, what are some things doctors don't determine a patient's quality of life. A patient determines their quality of life. And so I can't go in and say, I don't think you have a very good quality of life. The way I do, I go in and ask, what are some things that you enjoy doing? What are things that give your life meaning? And that's what, because every patient, and we consider the family part of the entire unit, they define it differently. One patient and family may say, I would never want to live in a nursing home with a traumatic brain injury and be on a trach and have all my nutrition through an artificial tube in my stomach. That's not a quality of life that I would find acceptable.